Dear students, today's topic is about intercostal spaces. So here there is an image of rib cage where you can see anteriorly by sternum and anteriorly and laterally it is formed by the ribs, and posteriorly we can see the vertebrae along with the intervertebral disc. So talking about this intercostal space. So intercostal space is the space between two ribs. Means you are seeing the gap between the two ribs. These gaps are called as intercostal spaces. So the spaces between the two adjacent ribs and their costal cartilages are known as intercostal spaces. So the adjacent ribs and between the costal cartilages too, altogether it extends posteriorly till the vertebra on each side of the vertebrae is called as intercostal space. So since there are 12 ribs on either side, thus there are 11 intercostal spaces. So how many totally? We have got 11 intercostal spaces. So we know now we have got 11 intercostal spaces. Out of these 11 intercostal spaces, the 3rd to 6th intercostal space are considered as typical intercostal spaces because the blood and the nerve supply of these spaces, means blood and nerve supply of 3rd to 6th intercostal spaces is confined only to thorax, means the spaces above to 3rd, that is 1st and 2nd intercostal spaces, they not only supply the thoracic region, they also supply the upper limb and the neck region. And beyond 6th, means beyond 6th, that is 7th, 8th, 9th till 11th intercostal spaces, the nerves and blood vessels also supply the anterior abdominal wall. So that is the reason the 3rd to 6th intercostal spaces are typical intercostal spaces. So 3rd to 6th are considered as typical intercostal spaces. So let's see the contents of a typical intercostal space. So here is an image of a typical intercostal space where we can see 3 intercostal muscles. The 3 intercostal muscles which are present between the ribs are external intercostal. So the outermost here is the external intercostal. Okay, the second muscle is internal intercostal muscle. So after external intercostal, the next deeper is the internal intercostal muscle, and the deepest, the third muscle is innermost intercostal muscle, which is called as intercostalis intimus. So this muscle is innermost one. So this is considered as intercostalis intimus, that is the innermost intercostal muscle. So apart from these 3 muscles, we have got nerves which are called as intercostal nerves, and along with the nerve we can see an artery here which are the intercostal artery and a vein, intercostal vein. So the nerve, artery, veins are present here. We can see first is the vein, intercostal vein, next to it is the intercostal artery, and below the artery is intercostal nerve. So these are present in a typical intercostal space, and they are the typical intercostal nerves and blood vessels. So all these 3 structures, means the vein, artery and nerve, they form together neurovascular bundle. So this neurovascular bundle runs in a plane called neurovascular plane, means the typical intercostal nerve and vessels, these structures are present between internal intercostal muscle and innermost intercostal muscle. So you can see here, this muscle is the internal intercostal muscle and deepermost is the intercostalis intimus, which is otherwise called as innermost intercostal muscle. So between these two muscles we find this neurovascular bundle, which is considered as the neurovascular plane of typical intercostal space. And these structures are present between, I'll repeat again, internal intercostal muscle and innermost intercostal muscles. So that is why between the intermediate and deep layers of the muscles, they are arranged in this order, like vein, artery and nerve. We can say as van structures. So first, from above downwards, it is vein, artery, nerve. Intercostal vein, intercostal artery and intercostal nerve. So let's talk about the intercostal muscles. Okay, so after we completing the contents, now we know what are the contents present in the intercostal space. That is the intercostal nerve and intercostal vessels. And apart from nerves and vessels, we have seen the three sets of muscles: external intercostal, internal intercostal and intercostalis intimus. So in fact, the intercostalis intimi is not present in the intercostal space, as it lies in the deeper aspect of the ribs. It is not between the ribs, it is on the deeper aspect of the ribs. And nerve supply to all these intercostal muscles, it is supplied by intercostal nerves. And in common, if we see the action of these muscles, intercostal muscles act as a strong support for the ribs, preventing their separations. So they are binding between the two ribs, preventing the separation of the two ribs. And these muscles elevate the ribs during respiration. They help it during respiration. External intercostal muscle act during inspiration, while the other muscles act during expiration. So let's talk about external intercostal muscle. So if you see the origin of external intercostal, it gets origin from the lower border of the rib above. So from the upper rib, it gets origin. So we can see it gets origin from the upper rib, and the fibers runs forwards, downwards, medially, inserting into the upper border of the lower rib. So next muscle is the internal intercostal muscle. Internal intercostal muscle, if we see its origin, it gets origin from the floor of the costal groove of the rib above, and it gets inserted to the upper border, that is the inner lip of the rib below. And the extent of internal intercostal muscle, it gets origin from the lateral border of the sternum. So not only from it gets origin. So it is fleshy anteriorly, and posteriorly beyond the angle of the rib, it continues as posterior intercostal membrane. So anteriorly the internal intercostal muscle is fleshy, whereas the external intercostal muscle, anteriorly it forms a membrane and posteriorly it is fleshy. So that is the important thing which you have to note down. So if we see the extent of the internal intercostal muscle, it gets extend from the lateral border of the sternum, and it extends till the angle of the rib. So up till here only it extends. Beyond that it continues as the membrane. So beyond it continues as posterior intercostal membrane. So that is about the external and internal intercostal. So if we see the directions of this muscle, it is exactly at right angles to the external intercostal muscle. External intercostal muscle runs forwards, downwards, medially like this, how we keep your fingers in the pocket. Whereas internal intercostal is exactly opposite, like upwards, forwards, medially like this. So they are at right angles to each other. So the nerve supply of this internal intercostal is same as external intercostal. The same intercostal nerve of the same space supplies it, and action of it elevates the rib during expiration. So that is the action of internal intercostal muscle. Okay, let us discuss about the innermost intercostal muscles. Innermost intercostal muscle, we can also term it as transversus thoracis muscle. Transversus thoracis muscle is again having three parts. We can subdivide into three separate muscles. Intercostalis intimus. So the deeper is the intercostalis intimus. The origin of intercostalis intimus, it gets origin from the inner surface of the rib above, and it gets inserted to the inner surface of the rib below. So from the inner surface of the rib above to the inner surface of the rib below. And if we see the extent, it is not present all through the interval of the intercostal space. It is just confined to the middle 2/4, means almost middle half of the intercostal space. And directions of these fibers, it is upwards, forwards, medially, just like intercostalis muscle. Similar to that, the upwards, forwards, medially, right angles to external intercostal muscle. So that is the action, that is the direction of these fibers. And let's see the nerve supply. The nerve supply is intercostal nerve of the same space will supply this third muscle also. And action, it elevates the rib during expiration along with the internal intercostal muscle. So that is the action. The second muscle is the subcostalis. The subcostalis, if we see its origin, it gets origin from the inner surface of the rib near the angle. So it gets origin from the angle of the rib, and it gets inserted to the inner surface of the second or third ribs. So it gets inserted to the inner surface of second or third ribs below. So that is about subcostalis muscle. And extent of subcostalis, it is confined only to the posterior part in the lower spaces. It is not present in the all spaces. It is present only in the lower intercostal spaces. And direction is upwards, forwards, medially. So it is upwards, forwards and medially, along with the internal intercostal muscle. And nerve supply is intercostal nerves, and action is they are the depressors of the ribs. From the posteriorly, they will depress the ribs, the lower ribs alone. Okay. And the third part of the deeper muscle is the sternocostalis muscle. Sternocostalis muscle gets origin by lower 1/3 posterior surface of the body of the sternum. So it is getting origin from the body of the sternum, posterior surface, lower 1/3. It also gets origin from the posterior surface of the costal cartilages of lower 3 or 4 ribs. So lower 3 or 4 ribs together along with the sternum on the posterior surface, they give origin. Near sternum, they give origin. And let's see its insertion. It gets inserted to the costal cartilages of 2nd to 6th ribs. And extent, it is present on the inner surface of the front of the wall of the chest. So it is present only in the front wall of the chest and upwards and laterally. The direction of the fibers are upwards and laterally. And nerve supply, same as others, intercostal nerves. And action, it draws the 2nd to 6th costal cartilages downwards. It pulls the 2nd to 6th costal cartilages downwards. So this is all about the origin, insertion, action, nerve supply and direction of fibers of all the intercostal muscles. Let's talk about intercostal nerve. So we know all these muscles are supplied by this intercostal nerve. So it is important to learn the intercostal nerve also. So the thoracic wall is supplied by 12 pairs of thoracic spinal nerves. So all these 12 pairs of thoracic spinal nerves, they supply the thoracic wall. So these nerves, they come out through the intervertebral foramen. So as soon as they leave the intervertebral foramen, so intervertebral foramina, they are present on each side of the within the vertebral column, and we can see the ventral root or anterior root, and here is the dorsal root, And this is the dorsal root ganglion. And we can see the ventral root, we know it is motor, whereas the dorsal is the sensory. They are joining to form a mixed nerve here. Which comes out through corresponding intervertebral foramen. And this is the sympathetic ganglion. Which communicates with the ventral rami. So once the spinal nerve forms the mixed nerve, it divides into ventral ramus. This is the ventral ramus. And here is the dorsal ramus. And sympathetic ganglion communicates with the ventral ramus with grey rami communicantes. So as soon as the nerve comes out through the intervertebral foramina, they divide into ventral and dorsal rami, otherwise called as anterior and posterior rami. So the anterior primary rami of upper 11 thoracic spinal nerves, that is from T1 to T12. So upper 11 from T1 to T11 are all called the intercostal nerves, and they course through the intercostal spaces. So these nerves are intercostal nerves, and the anterior primary ramus of 12th thoracic spinal nerve runs in the abdominal wall below the 12th rib. So it is considered as subcostal nerve. So T12 is the subcostal nerve. I hope it is clear. T1 to T11 are intercostal nerves and T12 is the subcostal nerve. So the unique features is the intercostal nerves are the anterior primary rami of thoracic spinal nerves. So dorsal ramus doesn't comes into picture at all. We can see the ventral ramus alone is running here as the intercostal nerve. So all the ventral ramus or anterior primary rami from the spinal cord, they form the intercostal nerves, and they are in segmental characteristics. Unlike the anterior primary rami of other regions of the spinal cord, they form nerve plexus. Like in the cervical region, brachial plexus, cervical plexus, and in the lumbar and sacral, they form lumbosacral plexus. So before supplying a particular target organ, they form plexus. Whereas in the thorax, they doesn't form plexus. Directly they go and supply in a segmental innervation. So that is the unique feature of these thoracic nerves. So let us do the classification of these intercostal nerves. Intercostal nerves can be classified into two groups: typical intercostal nerve and atypical intercostal nerve. So we can classify into two groups: typical and atypical. So typical intercostal nerves are 3rd to 6th, means the 3rd to 6th we know they are the typical intercostal spaces also. So the same spaces. So 3rd to 6th means 3rd, 4th, 5th, 6th are the typical intercostal nerves, and atypical intercostal nerves are rest of the intercostal, means 1st, 2nd, and after 6th, 7th till 11th are considered as atypical intercostal nerves. The typical intercostal nerves are those which remain confined to those their own intercostal space, means they supply only the thoracic wall and they are present in that particular intercostal space. Whereas atypical intercostal nerves, they extend beyond the thoracic wall and they partly or entirely they supply the other regions. That is the reason they are called atypical intercostal nerves. Now let us discuss about typical intercostal nerve, So the typical intercostal nerves are those which remain confined to their own intercostal spaces. And if we see its course and relations, the typical intercostal nerve, after its origin, it turns laterally behind the sympathetic trunk. So here is the sympathetic trunk. And we can see this is the typical intercostal nerve. And then it enters the intercostal space between the parietal and posterior intercostal membrane. So it is posterior intercostal membrane is what? It is the aponeurosis of internal intercostal muscle itself. And then further it enters the costal groove of the corresponding rib to course laterally and forwards. In the costal groove, we know the van structures VAN from above downwards. So in the costal groove, it comes into relationship with the corresponding intercostal vessels and forms a neurovascular bundle of the intercostal space. So from above downwards, vein and then artery and nerve are present in the costal groove. So near the sternal end, so if we see here is the sternal end. So near the sternal end, the intercostals of the intercostal space, the typical intercostal nerve crosses in front and of the internal thoracic artery, and then it pierces the internal intercostal muscle and anterior intercostal membrane. Anterior intercostal membrane is the aponeurosis which is formed by external oblique muscle. So just now we discussed external oblique muscle continues anteriorly as anterior intercostal membrane. Okay, and it also pierces the pectoralis major muscle which is present anteriorly in the chest wall to terminate as anterior cutaneous nerve. So here is the anterior cutaneous nerve. So finally it terminates as anterior cutaneous nerve. So the point which you have to note here is, if you see the course of this typical intercostal nerve, the nerve lies between the pleura and posterior intercostal membrane. Posterior intercostal membrane is formed by internal intercostal muscle, and so it is lying between the posterior pleura and posteriorly to the posterior intercostal membrane. Whereas in its greater part, that is the greater part in the intercostal space, it lies between internal intercostal muscle and internal costalis intimus, that is internal intercostalis intimus muscle, that is the deeper muscle where we discussed neurovascular plane is present. And the branches of this typical intercostal nerve, it has got muscular branches, and these are small tender branches from the nerve which supply the intercostal muscles and also serratus posterior and superior muscles also. So that is, these are the branches. These are all the motor branches or muscular branches. Then rami communicantis. Each nerve communicates with the corresponding thoracic ganglion, that is the corresponding thoracic sympathetic ganglion, by rami communicants. Rami communicants means so each nerve, we can see it communicates with the corresponding thoracic ganglion by white and grey rami communicants. So these are white and grey rami communicants, you can see here, where it communicates with the sympathetic ganglion, which is nothing but the thoracic sympathetic ganglion. Collateral branch. Collateral branch, it is arises in the posterior part of the intercostal space. So the posterior part of the intercostal space, collateral branch arises, and this it is almost near the angle of the rib. It gets its origin, and it runs in the lower part of the space along the upper border of the rib below, and in the same neurovascular plane along with the typical intercostal nerve it runs, and it supplies intercostal muscles, parietal pleura and periosteum of the rib. And let's talk about the lateral cutaneous branch. So here is the lateral cutaneous branch, and it arises in the posterior part of the intercostal space near the angle of the rib and accompanies the main nerve for some distance, and then pierces the muscles of lateral thoracic wall along the mid-axillary line. So we can see it pierces the lateral thoracic wall along the mid-axillary line, and it divides into anterior and posterior branches to supply the skin on the lateral thoracic wall. So here is the anterior branch, and this is the posterior branch, which supply the lateral thoracic wall. It is a cutaneous nerve, so it is the lateral cutaneous nerve. And let's discuss about the anterior cutaneous nerve, which we mentioned earlier. It is a terminal branch of the typical nerve which emerges on the side of the sternum, means it emerges on the either side of the sternum, and it divides into medial and lateral branches and supply the skin in front of the thoracic wall. So here is the lateral branch, and this is the medial branch of anterior thoracic nerve. So that is about the typical intercostal nerve. And there are atypical intercostal nerves also. That is, the first intercostal nerve is an atypical intercostal nerve. So the greater part of this nerve joins the ventral ramus, that is the C8 spinal nerve, to form lower trunk of brachial plexus. So the greater part of it contributes in the formation of brachial plexus. The remaining part of the nerve is very small, and it lacks both lateral and the anterior cutaneous branches. So what we saw, the lateral and anterior cutaneous branches are absent in the first intercostal nerve. And the next atypical nerve is second intercostal nerve. Second intercostal nerve, its lateral cutaneous branch is called as intercostobrachial nerve, and this intercostobrachial nerve courses along the axilla, along the floor of the axilla, and it joins the medial cutaneous branch of arm. So the intercostobrachial nerve supplies the skin of the floor of the axilla and upper part of the medial side of the arm. So in coronary arterial disease, means if there is any disease in the coronary artery or cardiac pain, it is referred along this nerve to the medial side of the left arm. So that is the clinical importance of intercostobrachial nerve, which is present with the second intercostal nerve, which you won't see in the other nerves. So that is the point of difference. And the other atypical nerves are 7th to 11th intercostal nerves, which we would discuss together. So these nerves leave the corresponding intercostal space to enter the abdominal wall. Hence, they are all called thoraco-abdominal nerves. So they are not only supplying the thoracic region, they also supply the abdominal region. That is the reason they are called as thoraco-abdominal nerves. And these nerves supply the intercostal muscles of the corresponding intercostal spaces. So in addition, they supply the muscles of the anterior abdominal wall like external oblique, internal oblique, transversus abdominis and rectus abdominis muscle. Skin and the parietal peritoneum covering the outer and the inner surface of the abdominal wall are also supplied by these 7th to 11th intercostal nerves. So these are the atypical intercostal nerves. Let us discuss some clinical correlation associated with these intercostal nerves. So first thing is intercostal nerve block, and it is given to produce local anesthesia in one or more intercostal spaces. So we do the anesthesia to one or more intercostal spaces by injecting the anesthetic agent around the nerve trunk near its origin. So that is why just lateral to the vertebra it is given. Okay, now let us discuss about the second clinical aspect related to this topic is root pain or girdle pain, means irritation of intercostal nerves caused by the disease of thoracic vertebra. So if there is a disease in the thoracic vertebra like TB thoracic vertebra, it may cause the irritation of intercostal nerves and produces severe pain which is referred around the trunk. So along the cutaneous distribution of the affected nerve, and it is termed as root pain or girdle pain. Next condition is the Pott's disease. Pott's disease is the collection of pus due to TB, tuberculosis of the thoracic vertebra. So the thoracic vertebra gets infected because of TB or tuberculosis and it gets liquefied forming pus. So the pus tends to track along the neurovascular plane of the space and may point at three sites of emergence of cutaneous branches of thoracic spinal nerve. So intercostal nerves, that is the anterior primary rami of the thoracic nerves, or it may radiate to the just lateral to the sternum in the mid axillary line, and the third point is lateral to the erector spinae muscle which is present on the either side of the vertebral column, just lateral to the erector spinae muscle. So at these 3 points we see the pus tracks down and causing the irritation of nerves, which is called as Pott's spine. Okay, the next condition is about herpes zoster. In late term we can say it as shingles, and it is a reactivation of chickenpox virus in the body and causing a painful rash which is called as shingles or herpes zoster, involving the thoracic spinal ganglion, cutaneous vesicles appearing in the dermatomal area of distribution of intercostal nerve. So wherever the skin supplied by the intercostal nerve, that area we see these rashes, and it is extremely painful condition. So that is about herpes zoster. The next common surgery which is done related to thorax is thoracotomy. Thoracotomy is a surgery to open the chest, and it is performed by making the incision in the chest wall between the ribs, usually to penetrate to the lungs. So the conventional thoracotomy, it is done on the posterolateral aspect. So it is done on the posterolateral and it is performed along the sixth rib. So the neurovascular bundle is protected from the injury by lifting the periosteum of the rib. So that is about the thoracotomy procedure. Next, insertion of needle. How you insert the needle into the intercostal space. So considering the position of neurovascular bundle, we know the neurovascular bundle is mainly present in the costal groove. So it is present in the intercostal space, especially in the costal groove. So it is safe to insert the needle a little above the upper border of the rib below. So it not in the upper part, in the lower part of the intercostal space, it is the safe space to insert the needle. So that is about this intercostal nerve and some clinical correlations. Let's move on to intercostal arteries. So the thoracic wall has rich vascular supply by posterior and anterior intercostal arteries, and each intercostal space contains one posterior and two anterior intercostal arteries. So here is the posterior. So this is an image viewed from above to show both the sides, the courses of intercostal arteries, and anteriorly we have got two intercostal arteries. Okay, so if you see the intercostal space, we have got a large posterior intercostal arteries and two small anterior intercostal arteries. So each space is like that. Now we shall discuss about the posterior intercostal artery. So the total number, like there are around 11 pairs of posterior intercostal arteries in each space. They supply the greater part of the intercostal space. So we can see the thoracic aorta, and on each side we can see it is numbered as 1 to 11, which are considered as posterior intercostal arteries. And if we see the origin, the first and the second posterior intercostal arteries are the branches of superior intercostal artery. So here is the first and this is second. They are the branches of superior intercostal artery, and which is further a branch of costo-cervical trunk. Superior intercostal artery is a branch of costo-cervical trunk. And 3rd to 11th posterior intercostal arteries arise directly from the descending thoracic aorta. So we can see 3rd to 11th, they are getting origin from each side of the descending thoracic aorta. Let's talk about the course of the posterior intercostal arteries. Posterior intercostal arteries, they run in front of the vertebra. We know the thoracic aorta is present in front of the vertebral column. So the right posterior intercostal arteries are longer than the left because the descending aorta, what we saw, this descending thoracic aorta, it is not in the midline. It is present on the left side of the thorax. So that is the reason the right posterior intercostal arteries take a longer course than the left posterior intercostal arteries. So these posterior intercostal arteries, they pass behind the esophagus, thoracic duct, azygous vein and sympathetic chain, but in front of the anterior aspect of vertebral body. So they run posterior to these structures, anterior to the thoracic vertebral bodies. We know the left posterior intercostal arteries are smaller and they pass behind the hemiazygous vein and sympathetic chain, but in front on the side of the vertebral body. So that is about the left side posterior intercostal veins. In the intercostal space, the posterior intercostal artery lies between the intercostal vein above and the nerve below. We know vein structures are there, VAN. So vein is above and nerve is below. The artery is sandwiched between vein and nerve. So the neurovascular bundle in the intercostal space lies between the internal intercostal muscle and intercostalis intimus. So if we see the termination of the posterior intercostal artery, it ends at the level of costochondral junction, means anteriorly between the ribs, that is the costa, and their costal cartilages. So at that junction they get terminated. So they terminate at the level of costochondral junction by anastomosing with the upper and upper anterior intercostal arteries of the space. So we can see here it ends by anastomosing with the anterior intercostal arteries. So dorsal branch, let's see the branches. So dorsal branch, it supplies the spinal cord, vertebra and muscles and skin of the back. So this is the dorsal branch which supply on the dorsal side, supplies the spinal cord also, forming the segmental arteries supplying the spinal cord, vertebra and the muscles near the vertebral column and also the skin on the back side. And collateral branch, it arises near the angle of the rib and it runs forwards along the lower border of the rib. So collateral branch, it arises near the angle of the rib and runs forwards along the upper border of the rib and below it ends by anastomosing with the lower anterior intercostal arteries. And muscular branches, they supply the intercostal, pectoral and serratus anterior muscle. So we can see several muscular branches to supply the pectoral. And lateral cutaneous branch, it is closely follows the lateral cutaneous intercostal nerve, branch of intercostal nerve. So lateral cutaneous branch is this one. Lateral cutaneous branch which closely follows the lateral cutaneous branch of intercostal nerve. Then mammary branches, external mammary arteries, they arise from the posterior intercostal arteries of second, third and fourth intercostal spaces to supply the mammary gland. Then about the right bronchial artery, it arises from the right posterior intercostal artery. So let's see about some clinical aspect. So next about the paracentesis thoracis. What is this paracentesis thoracis? It means the aspiration of fluid from the pleural cavity, which is called as paracentesis thoracis. So during this procedure, the needle should never be inserted medial to the angle of the rib because posterior intercostal artery is present there. So to avoid injury to the posterior intercostal artery as it crosses the space obliquely from below upwards. So that is about paracentesis thoracis. Let us finish off the other arteries also, that is anterior intercostal arteries. There are two small anterior intercostal arteries. We can see here in this image, and they are present in the upper 9 intercostal space. So these are present only in the upper 9 intercostal spaces they are present. And let's see the origin. First to 6th spaces, they arise from internal thoracic artery. So this is so first to 6th spaces, the anterior intercostal arteries, they arise from the internal thoracic artery. And in 7th and 9th spaces, they arise from the musculophrenic artery. So the 10th and 11th intercostal spaces do not extend forward and enough to have the anterior intercostal arteries. So let's talk about the termination. The anterior intercostal arteries are short and end at the level of costochondral junction. We already discussed the anastomose here at the level of costochondral junction. The upper anterior intercostal artery anastomose with the corresponding posterior intercostal artery. So the upper one goes with the corresponding one, whereas the lower anterior intercostal artery anastomoses with the collateral branch of the corresponding posterior intercostal artery. So this is the collateral branch. So it ends by anastomosing with the collateral branch. So each intercostal space contains two anterior intercostal veins also. So when it comes to, that's how the anterior intercostal arteries terminates by their anastomosing. Let's talk about the intercostal veins. The number of intercostal veins corresponds to the number of intercostal arteries. That is, like each intercostal space contains two anterior intercostal veins and their tributaries corresponds to the branches of the arteries. Let's talk about the anterior intercostal veins. They are present only in the upper 9 spaces and each space contains two veins and accompanies the anterior intercostal arteries. Termination, the upper 6 spaces they end, that is intercostal veins, they end in the internal thoracic vein, and in 6th to 8th and 9th spaces they end in the musculophrenic vein. So let's see the termination where these veins end up. The upper 6 spaces they end up in the internal thoracic vein, whereas 7th to 9th, that is in 7th, 8th and 9th spaces, they terminate into the musculophrenic vein. Let's talk about the posterior intercostal veins. They are present in all spaces and each space contains only one posterior intercostal vein, just like posterior intercostal artery, and each vein accompanies along with the posterior intercostal artery and its tributaries corresponds to the branches of posterior intercostal artery. And if we see its termination, the mode of drainage of posterior intercostal veins differs from right and left side. So termination on the right and left side. So the right posterior intercostal veins, that is the first one, highest one, drains into right brachiocephalic vein. Second, third and fourth join to form right superior intercostal vein, which in turn drains into azygous vein. 5th to 11th drains into azygous vein, whereas the subcostal vein drains again into azygous vein. So right side they drain into azygous vein and left side the highest one drains into left brachiocephalic vein. Second, third and fourth joins to form left superior intercostal vein, which in turn drains into left brachiocephalic vein. 5th to 8th drain into accessory azygous vein. 9th to 11th drain into hemiazygous vein. And subcostal vein drains into hemiazygous vein on the left side. So that is about the venous drainage of intercostal veins. So that's how we completed the intercostal space. I hope you understood this topic. Thank you.